Hey guys, welcome back to Defeating Hair Loss. My name is Steve. I'm lucky again tonight to have Bobby back with me. Bobby, welcome back.
Appreciate you having me, Steve.
Thanks for being my model again.
I try to do my best.
Hair's looking amazing. So I actually am going to use you as a model tonight. Sometimes we just kind of say I always do, which I do. But you, of course, had your 2 surgeries in your hairline with one of my top doctors in my kind of network, Dr. Dan McGrath in Austin, Texas, correct?
Yes, sir.
Okay. So we're talking about FUT scars. Now, I won't go over and over and over. We've had other videos, Bobby, about why you decided on FUT.
Yep.
But you've had 2 procedures, so you're scarring. Have you had any issues?
No, not at all.
No issues. Okay, and you're a pretty big guy.
I'm trying to catch up with you, Steve. 225 for 10.
So you going back after surgery number 1, you probably followed. I'm sure you followed the post-op instructions. Yeah. You're one of those guys like me that follows the rules. Yeah. And did you have any issues in the gym afterwards?
No, not at all.
Everything felt fine.
Yeah.
Procedure number 2. Any concerns?
Same thing.
So no issues. And here we are. How many years after your second procedure?
It's been at least 2.5 probably.
And you're feeling?
Yeah.
Okay. So what I want to point out to you, okay, is that Bobby is pretty much normal. Bobby is,
somewhat.
The doctor, somewhat. Bobby is the type of patient that the top quality doctors out there are looking for. And that without to sound like we're, segregating or we're not, we're turning away patients for whatever reason, only if they're not healthy, only if they have blood issues, or if they have poor donor hair. Most of those patients, we want to put them on the medicine to create a better environment for their donor hair. But the top doctors are not going to do surgery on people that are not going to get those benefits. And Bobby's a great example. They did everything right, followed his doctor's pre-op and post-op instructions, even with the coffee, which I know you like.
Yeah.
And
bring it here every time.
And he's back in the gym. He was back in the gym right away. So that's the normalcy of FUT. Of course, and I want to turn this into a video of FUT versus FUE and all that stuff. But for reasons that you're a better candidate or you choose FUT for certain reasons like Bobby did, and we've done videos on that, this is absolutely atypical type of patient that the way they recover from a doctor that really is good at what they've done. They're a specialist. They know how to do surgery. They know how to take an FUT strip procedure and close that and instruct the patient properly. Now, why do we see a bunch of stuff online about avoid FUT, you don't want that scar, all that kind of stuff? For obvious reasons. The reasons are, without sounding like a conspiracy theorist, that there's not a lot of good hair surgeons out there. They were sold an FUE machine and told by an FUE salesman that they can do hair transplants. So again, what we want you and asking you to do is to seek out the doctors that do both FUE and FUT. That way there's no bias in which way you should go. Now, back to FUT scars. That's what this video is all about. Weightlifting. So Bobby went back to the gym probably a few days after your sutures came out.
Yeah, fast as I could, Steve. As soon as they let me.
And there's no issues.
No.
Okay. So again, normal. Okay. What would be abnormal? Well, if you go back to the gym the day the suture line comes out and you're not a bodybuilder or a fitness guy like Bobby, you are a power lifter and you do 415 pounds.
Yeah, how you doing that, Steve?
No, be careful with that. So we want you to be kind of ease yourself back into it. I remember us both procedures talking about that.
Yes, sir.
Okay, that's number 1. Number 2 is, what if it's your second FUT? Now, again, I've got my model. He's had 2 FUTs. And going back to the gym, just in case that your skin's a little tighter, your doctor will normally tell you that. He'll say, be careful. This procedure was a little tighter than the first because obviously we're taking tissue. So now you want to be even more cautious going back to the gym. Now I know, and I've been asked questions about some doctors out there that are so nervous that you're going back to the gym, they tell you to wait, 2 months, 3 months, 4 months, 6 months. That's, in my opinion, that's not going to work. I got to get back to the gym sooner than that. Just ease yourself back in and don't do the heavy squatting, the heavy shoulder presses, the deadlifts and all that stuff. Ease yourself back in. So that's something to be careful with if it's your second procedure.
Yeah, you don't have to worry about legs with me, Steve, and don't worry about heavy squats.
All right, come on, you got good legs. You just happen to have that height, man, so I can't get any taller. So Bobby did great. I mean, I've had multiple FUT procedures in the course of my life. I've never had a problem either. Stretchy skin. Stretchy skin is something you may not know you have. Well, How do you find out if you have stretchy skin? Well, you may have a scar on your body from something else, like maybe a surgery. Maybe when you were a little kid, you had some stitches in your skin or whatnot in your knee and your elbow, and you had, you can kind of let your hair surgeon look at the way you heal. It's all about how you heal and if you're going to follow those post-op instructions. But there are some men out there, I can't think of many women in my experience that this happened to, that just happen to have stretchy skin, and they're not a lot. There's not high numbers of those. So again, I don't want this video to scare you away from FUT if you're a better candidate for that. Excuse me. But we want to make sure that if you've got any issues in your skin and your doctor that had done surgery on another part of your body would tell you that, make sure you make that clear to the hair doctor, because then he may switch you over to FUE for the fact you might have a little wider scar just by the way you heal. The last thing I'm going to warn you about, of course, this is the easy one that Bobby did his research. Make sure that you don't go to an inexperienced hair doctor. Ask the questions. What's your surgical skills? When you've done FUT, how many have you done? Can I see some examples of your closure? Can you talk to me about how you're going to close my wound? Talk to your doctor. Just have a common sense back and forth during your consultation, and you'll be able to tell pretty quickly if he is a skilled surgeon that has done this a lot. What you don't want is to go to a very pompous plastic surgeon, because nothing against plastic surgeons, but plastic surgery is a board certified, very high-end type of cosmetic practice. Doctors think hair transplants, or at least plastic surgeons think hair transplants is kind of like below them. At least that's my experience. Not all the time, but sometimes. And they think this is easy. So you don't want to be that one to step into that plastic surgeon's office because he did your girlfriend or your wife's breast augmentation and she looks like a Playboy centerfold. So he did such a good job on her breast, he's going to do a fantastic job removing a strip out of the back of your head. Do not assume that. Make sure you see the evidence. Make sure you ask them the right questions, because it's too late once it's done.
Yeah.
And then, last thing I'll say is then we got to do a scar revision where we actually have to take out another strip and close it properly, and that's going to make it even tighter. All this stuff is not meant to put any fear in you. Hey, Steve, I saw your video. You know what? I'm just going to do FUE. Because FUE can screw you up too if it's not done right. So those of you out there that are looking at FUT, again, I'm always available for questions, comments. Bobby's a model, a really handsome model on it works, and it works really well when it's done right. And I hope this helps you with your decision, especially if you have a lot of hair loss and you're ethically not really a candidate for FUE. You are a candidate for FUT, and this will help put your mind at ease. So a large number, I would say in the 95% or above, are going to heal properly. They're going to pick a right doctor. They're not going to have an issue, and they're going to get a lot more hair and more quality of it in an FUT procedure. And I hope this helps you in your decision. Don't forget to like and subscribe.